This episode is going to give you a new perspective on your pet's behavior, especially the things that feel confusing or often get dismissed as stubbornness, naughtiness, or even normal. Today you'll learn what a behavior consultation can offer you, the top behavior issues owners often struggle with, and what the first steps are that you can take even before booking that appointment. I'm your host, Dr. Kara, a veterinarian who believes owners deserve credible, evidence-based information rather than that Google spiral. My guest today is Dr. Aileen Pypers, a veterinarian and behavior consultant, the owner of Pets at Play Behaviour Consultancy in the Cape, and she works from the philosophy that behavior is communication and combines veterinary science and a real passion for empowering owners. If you enjoyed this episode, remember to like, share, and follow. Now let's get started.
I think it can be disheartening when you've done all the work of puppy school and maybe you've even gone on to the next lot of training classes, and then your dog develops cloth ears. You know, those ears just turn into these decorative appendages on the side of their head and they're just not listening to you anymore. As I said earlier, your dog's brain is only physically mature by the time they're 3 years old. So their brains are busy changing. And just like you relayed with your teenage son, you know, teenagerdom is something that is prevalent across the mammalian kingdom because it's how our brains develop. Mood swings, impulsivity, risk-taking, you know. Am I describing your teenage son or am I describing your teenage Labrador? They're doing the same thing.
So tell me more about Pets at Play. Have I got that right? That's your consulting role. You've set up a vet behavior
consultancy
offering to, yes, that's quite unique.
Yeah, so I have always been interested in behavior. I remember quite distinctly when I think I was in 4th or 5th year going to chat to Dr. Quixie Sontag, because she was lecturing us in that module at that point in time and saying to her, like, I'm really keen to kind of get into this, but there still aren't many postgraduate offerings in animal behavior or veterinary behavior or clinical behavior, whatever you want to kind of call it. And then I started working as a state vet initially because I had a bursary that I was working back for the government. And I mean, state vet was great. It taught me a lot and I had a lot of really cool opportunities while I was working there, but you don't get to handle that many animals when you're a state vet, even though I was in animal health disease control. And I really missed that kind of aspect of it. So I did a course that the university was offering as an honors level module. They've subsequently done away with the honors. But that particular module was an honors level module in clinical behavior medicine. And I did that. It was a year module and it was primarily online, but with 2 practical days. And at the end of it, I was like, right, I can do this. And one of my mentors at that time was Nicoline Swanepoel, who was also a vet who had taken a interesting sort of path in vetting and was working as an artist at the time. And I just remember her really encouraging me and saying, you know, behavior isn't actually that difficult. Sometimes the answer is really obvious, but because the person is just so in the middle of what's going on, they can't see it. And the amount of times that has kind of proven itself over the years where, you know, I say something to a client and they're like, oh, that's so obvious now that you've said it. Like, why didn't I think of that? And I was like, well, it's my job to think of that. But I then registered Pets at Play and started seeing clients on weekends and public holidays and in the evenings and that, because state veterinary work has got very sort of set, predictable hours. It made that possible. And then in 2018, I left the state and launched myself sort of full time. And I was really quite nervous. All I'd ever done was being a state vet prior to that and on the side, but I didn't know if there would be enough work for me as a full-time veterinary behaviorist. And really quickly, I just had some networks with some of the vets and reached out to them and let them know. And they, you know, started referring cases to me. I started speaking at conferences and CPD offerings and that. And at that stage, I was still doing home visits, so lots of driving around all over the countryside, which is a bit stressful. You know, if you've got hour and a half for this consult, and then you've got a half an hour drive to the next one, and then you run, 15 minutes late with this one, and then you get another 15 minutes of extra traffic. So I started trying to open my own practice here, and in January 2020, I opened the doors of my practice, and then 3 months later, we had COVID lockdown. So at least I still had my practice because vets were exempt during that initial hard lockdown. And so I was able to still see patients, not during the hard lockdown, but as lockdown started to lift, I was able to see patients, which really helped me to keep going. And yeah, it's just gone on from there.
And possibly a need more than ever after COVID of people having been at home with their pets and then suddenly having to return back to work. And I'm sure it was then that your services were particularly required.
Yeah. And just the fact that so many people did adopt pets during COVID as well. Mm-hmm. I did a CPD talk for the vets at some point during COVID. And I mean, I remember within a couple of months of that this initial sort of global hard lockdown, there were already papers starting to come out about the trends. I think the first one came out of Israel and was really, really interesting about how people had just kind of gone, oh, well, I'm home now. Now's the perfect time to get a pet. And a lot of shelters were also trying to empty out the shelter so that they, could also cut down on having their staff coming out there. So I know that one of the local South Africa, I think the shelter in Stellenbosch managed to empty itself just before that hard lockdown, and every single one of those animals went to a foster home during that time.
Incredible. Oh, how nice would that be if that was a permanent situation? Unfortunately, we're seeing them fill up again, aren't we?
Yeah.
And many of those with behavior cases. So before we go into the behavior itself, because obviously I would love us to dive into some examples. I'm going to ask some of the common questions. Let's talk some vet stuff too. But how do you explain what you do if someone says, what is a veterinary behavior consultant? How do you explain the kind of work that you do?
I generally tell people I'm a dog or cat psychiatrist because I think that helps them to understand the difference between a non-veterinary behaviorist and a veterinary behaviorist. And people then kind of get it a little bit more. And some people enjoy the fact that, they can tell their colleagues and their family that they've taken the dog to see the dog psychiatrist. But for people who don't understand, I basically just explain that I deal with problem behaviors, primarily anxiety related, fear related, and then aggression, obviously. So I used to say to people, I deal with dogs biting everything, each other, the family members, strangers, visitors, other dogs. So whenever there's biting involved, then I'm usually there. So
you're the one.
Yeah, that's kind of how I couch it for people.
And what moment in your early career made you realize that behavior is where you want to focus your time, and what was the inspiration?
I am a people person, which I think is not that common in veterinary science, in the veterinary industry, certainly among vets. I think there's lots of vets who would very much prefer to just work with animals and not have to ever deal with the other end of the leash. But I'm not that way. I really, really enjoy interacting with people. I love hearing about people's lives. I love sort of discussing their situations with them. So, I mean, my consults are all a minimum of an hour and a half. They're supposed to be a maximum of an hour and a half, but sometimes I do run over a little bit because there's just so much to discuss. And I really enjoy that kind of connection with people. It can get draining, and I have to look after my own mental health. And I do have a really good psychologist that I have regular debriefings with, because it can get really heavy taking on that burden of, the stress of the family that the dog is biting the other dog, or the dog has bitten the child, or their dog has killed another dog, or in the case of, maybe their dog has even killed another dog within the home or a cat in the home. And, that can be emotionally really taxing, but I enjoy that longer sort of engagement that I have with people and really developing those kinds of relationships with them. Yeah, so that's really, I think, what got me into it. And in a sense, it's a little bit less pressurized than, first opinion practice, because don't really have after hours. There's not that many behavioral emergencies. And I like being able to kind of plan and prepare. So clients fill in a long questionnaire before they come to see me. So I can already, if there's a little bit of research that I want to do about the case, if I can already see that it's going a particular angle, that I'm going to have to discuss something specific with them, then I can already kind of prepare for that. And my personality type is one that enjoys that.
Yeah. No, I can totally resonate with that. It's very similar to the nutrition work. So yeah, I agree that the ability to be able to look and research and think and mull is of great benefit in comparison to those people who thrive on emergency type work. So it's very different.
I cannot understand how people do ER work and emergency work. I think I would not survive even a day in sort of, especially after hours ER work, where you know that it's going to be something terrible because they're coming after hours, and it can just be anything, snake bite, hit by car, seizures. No, thank you.
No. So you made the mention of sort of anxiety and aggression-based sort of work. In terms of the top three, if that is number one, and correct me if it's lower on the list, but if that is number one, the sort of the biting, the bite injuries, what are the other typical, say, top three things that you see?
So I think some of it has got to do with the fact that there are a lot of behaviorists out there. So my skill set is related more to cases that are worse, right? So oftentimes people contact me and they're like, oh, I think, I heard you're a trainer or you deal with dog behavior problems. And, while it is nice every now and again to kind of take on those softer cases where it's just a matter of improving a bit of communication between the pet parent and the pet, or, enlightening them about enrichment activities, or, that kind of thing. That's not really where my expertise is better utilized elsewhere. So oftentimes it is the aggression cases, because those are the ones that have the biggest repercussions, right? Repercussions for members of a family, but then also for neighborly relations, and then obviously public liability as well. So if your dog has bitten another dog or bitten a person, the law is pretty strong in that regard with regards to your liability. So I think those are often the cases that land up with me, because that's when people are the most sort of desperate. And that's possibly why I perhaps see more aggression cases than, the average behaviorist who's also getting contacted about excessive barking and jumping up and pulling on the lead, leash reactivity and that kind of thing. And I think in terms of cats, the one that I used to, I don't do as many cats these days because I have a really great colleague who helps out with that. I just started getting too busy and couldn't do it all myself. So, but with cats, it was most often house soiling issues, because again, those are the things that impact on people's lives hugely. Nobody enjoys the smell of cat urine. So when your cat is making their stress known by urinating all over your belongings, it's something that you deal with pretty quickly. So that's not necessarily to say that those are the most common issues, but those are certainly the most common issues that I then see in practice. And then I think anxiety and fear, because again, those are the things that people kind of notice. So when the dog either becomes extremely difficult with going to the vet or the grooming parlor, or is just really things like thunderstorm phobias or noise phobias, where it really starts to be something that people can't ignore, and that's not to place any kind of blame on pet parents. I think there's a lot of lack of knowledge out there for people recognizing when their animals are experiencing any kind of mental or emotional distress. But it's also life, life is busy, and people often like, oh, I'll do something about that. I'll do something about that. I'll do something about it. And then just never kind of get around to it. So my busiest time of the year is generally always January, February. or after a significant, or again, July, August, after the holidays, because I think people have then spent a little bit more time with their pets, or they've had visitors come in, or they've had family who maybe haven't seen the pet for a little while. And in the same way that, you pick up a kilo a month and then it's your friend who sees you 6 months later who notices that you've picked up weight, or vice versa. It's the same when you're living with your pet every day. You don't necessarily notice how bad a problem is becoming until an outsider says to you, like, oh, wow, is your dog always so stressed, that people then choose to do something about that. And I think probably
there's an incident.
Or there's an incident, right? And then I think the third most common thing is probably then the obsessive compulsive disorders, because that is something that really has got a medical, an actual brain problem, as opposed to just being an external behavioral problem, which is what people often think. They think that there's nothing kind of wrong inside the dog. It's all just kind of like how they're behaving externally. And that's not necessarily the case. But I think in the case of the obsessive compulsive disorders, or if you want to call them abnormal repetitive behaviors, we really do have a biological basis for that condition. And I think many vets are then not comfortable in managing it. I think many of them are probably comfortable in managing the medical side of things, but then not everything else that goes with it. So, how do we also structure this animal's life, give them predictability and routine, provide enough enrichment, ensure that we are minimizing frustration and anxiety, to then help the medication as well to do its job.
You look at me, I look at you, I see the love in your eyes.
Health you can see, love you can feel. UltraPet, the science of love.
So just like a human psychiatrist, you obviously, in the same way, are able to prescribe medication. So can we have a chat about that? And I'm going to use a case example that we had in our practice the other day, and I got consulted on it. Obviously, as the owner of the practice, it was are you comfortable with me doing this? Because it may result in us losing this client. And I'm going to give you a bit of a backstory to it and try and be brief. Yeah. But essentially, we had a local behaviorist, as in trainer behaviorist, refer a case to us, and it was very similar to our discussion earlier about there had been a biting incident, and the dog had bitten the child, or was biting the child quite recently and multiple times. And so they were told, look, before something very serious happens, you need to get this dog and the situation under control. Go to your vet, because we're going to need more than just behavioral modification here. It's obviously quite a frightening thing for us to do and deal with, because unlike you, where you can say, I'm happy to prescribe this, but these are the expectations, and this is what I want you to do behaviorally, and counsel these clients. For us as veterinarians, you're often limited just with the information you've got available. You're not taking that kind of history. You're not having the opportunity to follow up. And it's from a liability perspective, it's quite a scary thing for us to do as general practitioners. Is this something that you've experienced a lot of your colleagues saying that they are far more comfortable, particularly in these high-risk cases when there are people and children? I'm not to say that obviously inter-house pets fighting isn't serious, but when there is a young child and a minor at risk, if an owner wants to be bitten and that's their dog and they want to take that risk, it's one thing. But a child is a scary situation to be advising on. How frequently are you saying that you're happy to take those on, and how do you manage that? And how do you advise us as general practitioners to manage those kind of cases?
So in those high liability cases, you're correct. There are legal ramifications of that as well. And I think that if you are not comfortable with doing that, in the same way that maybe you're not comfortable with dealing with an enucleation of an eye or a complicated orthopedic procedure, and you may then refer that client onto an orthopedic surgeon or to a specialist ophthalmologist, I think that rather do that if you don't feel comfortable. If it's kind of like, well, I can't afford that doctor, and, this is kind of like my last resort, then my advice is always have a good aggression release on file that you can get people to sign. And an aggression release essentially says that aggression is something that we cannot cure. right? It's not like an infection that if I give a course of antibiotics, that's going to go away. Even with medication doesn't cure aggression, right? Aggression is a normal part of a dog's behavioral repertoire. And in serious cases, what happens is that dogs have learned that the lower ends of the aggression ladder or the aggression scale are no longer sufficient for what they need to manage their environment or cope with the problem. And they've had to escalate up to the point that they are biting. And when dogs have a bite history, they are intelligent beings that learn. So in the same way, if somebody was taking your stuff all the time, like you're sitting at lunch and somebody's like taking stuff off your plate and you're like, excuse me, please don't do that. That's a little bit inappropriate what you're doing right now. And the person kind of ignores you and takes the next piece of food off your plate. And, you might be like, hello, did you not hear me? And maybe you'll shout at them. At some point, especially if you're having a bad day, you may escalate to either shoving the person or hitting them or, hopefully in polite society, we wouldn't need to reach that point. But the example is that if you've learned that is an effective way of dealing with a problem, you may not waste time using the lower level conflict resolution the next time. And so that is why we can never cure aggression cases. These dogs have learned that if I'm stressed, if I'm uncomfortable, if I don't like what this person, this dog, this child is doing to me, this is the quickest way to make it stop, right? And then equally, we're dealing with the fact that dogs are, they are living beings that have their own thoughts and emotions and feelings. And aggression is a normal part of their behavioral repertoire, that it's not abnormal for them. Dogs don't sit down and have peace negotiations. They use aggressive behavior with each other in order to communicate. Now, that's not to say that extreme aggression is normal. It's not. And in most cases, in fact, I've said this in a legal report before, that extreme aggression, so when dogs are showing inappropriate aggression, they're either not backing down when the other dog or the person is giving enough sort of appeasing signals to say, whoa, I'm sorry, I've heard what and I'm stopping. If the dog still continues with the bite at that point in time, that is abnormal aggression, right? If a dog bites multiple times or bites and hangs on, even when the threat has subsided, that is abnormal aggression. Right? And those are the things that need to be dealt with. So an aggression release essentially says to the owner, we cannot cure aggression. What I can do is help you to mitigate this aggression, and medication can play a big role in that, as can environmental management, behavior modification, things like using a muzzle, so using tools that protect people and other animals, using tools like crating your dog or excluding them from a situation when you have visitors over, if that's the particular risk. So an aggression release basically says that and says you are ultimately responsible. And if you cannot accept that responsibility and that risk, then the only thing that we can do at this point in time is behavioral euthanasia. That is the only way that I can guarantee that your dog will never bite again. Now, some people are very risk averse, and for them, that may be the only acceptable way to go. And that is all right. But if the owner is able to say, okay, I can sign this, I understand, I need to manage my dog, I need to protect people, I need to protect the public, visitors to my property, whatever the case may be, then I think you can give them the advice that they might not be able to find online, because we all know what a quagmire the internet can be. There's excellent information out there, but there's also terrible information out there. And I think that the veterinarian can be the guide there to help people find the resources that they need, to refer them on to qualified behaviorists. And I think that is oftentimes as well the place that a vet needs to say, I can prescribe medication that is going to help the situation, but this situation is serious enough that you also need to be doing behavior modification. And for that, you need to be working with a behaviorist one-on-one.
That's great advice. Now, I want to tackle the neutering conversation, but before we go down that route, I want to ask about breeds, because we obviously, as veterinarians, we appreciate that we have some really cute, very aggressive chihuahuas, But from a risk perspective, they're not the problem. It's generally the larger breeds, and there are certain breeds that are associated with behavioral issues. Can you take us through your advice when people are discussing breeds, even banning of certain breeds in particular countries, and your feelings about it?
So, yeah, this is a complex topic, and I almost want to take the cop out and just kind of like refer you to Taryn Blythe is a behaviorist here in the Cape, and she has done some work with the Pit Bull Federation, and they put out a media release a couple of months ago, and there's a really great blog on her website where she kind of discusses the genetics of sort of pit bulls and the bull breeds and what makes them dangerous as dogs. But I think to take a step back and have the broader breed discussion, and I think this, even for me as a veterinarian, I clearly didn't pay that much attention in those lectures on ethology, or at that point in time, I was like, why is this even important, right? But understanding where dogs come from and how they have co-evolved with people and what we bred all the different breeds to do and how that is then going to influence your dog's behavior is such an important thing for people to understand. And I think the vast majority of pet parents, unless they are breed fanatics, unless there's a breed that they really love and, they've had sort of their whole life and they know the kind of behavioral history of that breed, why that breed exists, the vast majority of the public just go, well, that's a poodle and that's a golden retriever and that's a Jack Russell. They don't necessarily understand where all these breeds come from. And one of the things that I often discuss with people is something like the trait of impulsivity, right? So impulsivity is a behavioral trait that is when you think about doing something, how quickly you then do that thing. Right? I notice something in the environment, how quickly I react to that. I decide I want to go and get a chocolate downstairs, and before I've even said goodbye, Cara, I'm up and I'm going out the door to go and get myself a chocolate. Or, somebody shouts at me, and before I even think about the repercussions of that, I shout back at them. So impulsivity is a trait that's involved in many behaviors because it influences how we then deal with those behaviors. If you've got an animal who's less impulsive, it's much easier to notice that something's about to go wrong and step in. Whereas if the animal is highly impulsive, before you've even had a chance to pick up your treat container and shake it to get your dog's attention, they're already running out the door and barking their head off at the fence, right? So impulsivity is a trait that we have bred into many of our dog breeds because that was what was useful when they were working dogs. Right? And my favorite example is a Jack Russell because they're really popular pets in South Africa and people think, they're great. They're small dogs. They're manageable.
Short coats.
The fact is, exactly, they've got the word terrier in their name and that should be alarm bells everywhere. So I always say to people, imagine you were a Jack Russell breeder, 100 years ago, and you had two Jack Russells and they were both sort of like lying around in the courtyard, and a leaf went blowing past. And the one Jack Russell before that leaf had even gone like 30 centimeters was up there and like investigated and was what it was. And the other Jack Russell kind of lifted their head and went, just a leaf, went back to sleep. Which Jack Russell would you breed from? Knowing that Jack Russells are bred to control vermin, right? And to catch rats and mice. I can guarantee you that that impulsive reactive one is going to be a better ratter. So what we now have is Jack Russells that have been bred for working and are highly impulsive and reactive. And now you have them in your home and you want them to be a great family pet, right? You want them to be calm with the kids. You don't want them to make a big noise when visitors come over. You want them to be fun and play with you and have lots of energy. But the rest of the time, they mustn't jump up and they mustn't dig in the garden and things like that. So understanding that we have bred a lot of these behaviors into our dog breeds. And if we understand that, so Jack Russells are likely to be way more impulsive than, for instance, golden retrievers, right? But that doesn't mean that you'll never get an impulsive golden retriever, because that's how genetics work. And I think that's something else that people don't understand. The amount of times people have said to me, oh, but I've owned Rottweilers my whole life and I've never had one like this. And I'm like, but your Rottweilers are not clones. Maybe all your Rottweilers previously were really well put together individuals, but this one has a slightly more anxious temperament, or hasn't had enough opportunity for socialization. And because their slightly more anxious temperament is now being combined with the fact that they haven't had as much opportunity for socialization, now they're a slightly nervous Nelly. And a big dog who's now a nervous Nelly is not something that we want, because they are more likely to react and to be aggressive and to bite, not because they're aggressive dogs, but because they're anxious or scared or stressed.
So talk about a Rottie. So I'm going to talk from personal experience, and this is why I love podcasting, because I can get all my questions answered. Yes. But having owned a Rottie, and of course now this will lead us into the age at which we should be advising owners to castrate or spay, but in particular, obviously, with the males, castrating them. As a vet, we understand the benefit of delaying castration, particularly for larger breed dogs, from a developmental perspective, managing hips and elbows and so on and so forth. And so, taking on the information that I had available, I was like, I have a very nice dog, great, disposition, really, family-friendly dog. I'm going to delay this. And not only did he then develop behaviors that meant he wanted to roam, but then he got himself in more situations that probably then, with the reaction of people roaming and the experience of then having fear around particular things, and then a tendency to bite. And by the time you then castrate them, that behavior is something that you need to correct rather than a preventative thing. So before, I just would love your thoughts around the whole discussion of what we should be doing, in terms of advising clients who have got dogs that are perhaps, higher risk in terms of that age at which we should be neutering or spaying.
This is a complex topic because I think there are so many different factors at play. So speaking purely as a behaviorist, my sort of first goal is always to have a well-balanced individual who's got, who can cope emotionally, who's got a resilient temperament. And I think that the first year of a dog's life is so important for that development, right? We know that a dog's brain is only really physically mature by the time they're 3. And there's a lot that goes on before then, right? So we also know that the majority of behavior cases are going to occur before a dog is 3 years old, right? They're going to start presenting with behavioral problems before they're 3. If your dog has been 100% fine until they're 6 and then they develop a behavior problem, there's definitely a medical diagnosis there somewhere. There's definitely something going on medically. But because dogs go through these various developmental stages before they reach the age of 3, that is also the time when they are most at risk of experiencing traumatic situations that start to create a fearful disposition or teach them that certain things are more scary or difficult than others. And for me, not just the fact that when we sterilize, we are taking away those hormones. But I think the actual process of being sterilized is something that can have a huge impact on an animal, particularly an animal who's already at risk. So an animal who's already slightly anxious, already slightly fearful, already a little bit wary about things. I often say to people, like, if you had a child, would you take your 12-year-old child and drop them off at the hospital for a surgery and be like, bye, sweetie, I'll see you later. Nurses are going to call me when you've woken up and I'll come fetch you, right? Absolutely not. You would be sitting there with your child until the moment that they wheel. In fact, you'd probably even be allowed to go into the theater with them until they've gone under then you would leave, and you would be right there when they woke up from their anesthetic. Because anybody who has ever woken up from an anesthetic knows that it is a traumatic experience. It's disorientating. You're confused. You don't know what's going on. Maybe you're feeling really nauseous. Maybe you are feeling really sore, right? And then you're surrounded by strangers. And even though they're very nice, and the nurse is patting you and saying, it's okay, sweetie, and would you like some water and that? All you want at that point in time is a familiar face and someone that you have a relationship with to be there to comfort you, right? And I think that is what is happening to our dogs and cats when they go in for surgery. And I think until every single practice in the world is a fear-free certified practice that has all the systems in place to protect the patient's mental health at the same time, I think that's a big risk that we have to be aware of and take the necessary steps for. So, for instance, if your dog is quite a fearful dog, delaying that until they're a little bit older, using some of the calming supplements if your dog is just mildly, worried, using the pheromone products, having the kind of relationship with your vet where you say, can I sort of kind of be there as soon as they are sort of waking up, and, even if you just there initially while they wake up and then they go back to sleep again, and maybe you can leave and go have a coffee and then come and fetch them later. I think those are really things that we need to think about, because I have seen a number of dogs who, after their sterilization, have taken a really big dip in terms of their fear, anxiety, and stress, and how they cope with life. And I think so much of that has got to do with, one, the drugs that they have to be sedated, they have to be anesthetized, but those drugs have a particular effect on how they feel. And then just the whole kind of experience of waking up and being in a sort of stressful place.
It's such an interesting perspective, and I totally understand exactly what you're saying. I think obviously intuitively we feel, I have a teenage son now. I can see, that just the becoming more defiant. And you speak about that impulse control. He also happens to have ADHD. So I'm like, well, that's, that's my child. So there are lots of things that resonate, and you try and associate with your patients and some of the behavioral things that you're seeing. But I see, obviously elevation in testosterone. You see, the guys, the teenagers, they get, firstly the impulse control issues, but also from a hormonal perspective, more likely to get into a fight, more likely to get into an accident in the car, a little bit more reckless, trying the world, making some mistakes. And it's difficult to know whether that is a similar route that our patients are taking in terms of gaining maturity, and whether that removal of those hormones at an early stage would actually be helping, or whether there is actually, data and scientific basis for delaying it, and as you say, to allow them to get to maturity without having those experiences. So it's a fascinating perspective.
Yeah.
On it, really.
Look, I think we have the option nowadays of chemical sterilization, so of using the suprelorin implant. I've heard people say it so many different ways. I say it's suprelorin, but I think it's a really difficult name to say. I don't understand why a drug company would name their product that, but we have that option these days. And, if that's the case where you want to delay for your dog to reach physical maturity before you sterilize, but testosterone is becoming a little bit of a problem, then we have the option of the suprelorin. But I think certainly for the dogs who are already quite nervous, that testosterone really helps them, right? So I definitely have a number of patients where I have advised that they don't sterilize their dog until much later, so that their testosterone can help them with their confidence. So I think certainly for dogs who are already quite nervous or anxious, I prefer to leave their testosterone in place because it helps them to cope, right? What you don't want is an anxious dog, and then you take away the testosterone, which is already just giving him a little bit of confidence, right? And I would argue even the same with the females with that estrogen. So if you've already got quite an anxious, fearful dog, you don't want to be sterilizing them at that point, and maybe not even ever, right? Maybe that's the dog that remains intact for their whole life, right? And I think that, that is then offset by the fact that they're already quite anxious. They're not going to be running off to go look for females because they're too nervous to leave home, right? They're going to be hanging around with their pet parent or their guardian. So for animals where they are behaviorally quite normal and maybe those hormone-driven behaviors are becoming problematic, then I think we have the option of like the suprelorin implant. So it's I'm not in favor of sort of like blanket statements. I think it's far too complex and a case.
You don't want to generalize, essentially.
Exactly, right? You don't want to generalize or say like we shouldn't sterilize any dogs before they're a year, or we shouldn't sterilize any dog before they're 6 months. I think that just like with behavior, we take into account the environment, the household, the risk factors. The decision around sterilization is something that is a discussion that needs to be had. And I think the one piece of advice that I'd like to give my colleagues, my veterinarians, is if you've got a dog who is already coming into your consult room as a young puppy and showing fear and anxiety and stress, one, refer there, start the behavior discussion there already, but don't make an automatic recommendation for sterilization at 6 months, right? Because
I hear that all the time.
These days we hopefully wouldn't do it with the larger breed dogs, but maybe you would still do it like for a Cocker Spaniel, right? And I would say if you've got a nervous Cocker Spaniel in front of you, that dog should not be sterilized while they're young.
That's so interesting, because that really definitely is still the recommendation with the majority of general practitioners. I'm sure people are going to shout at me saying, we don't, but I do hear it. So,
yes.
Your dog's aggressive. It could be hormonal. First thing you need to do is castrate the dog or spay her.
Yeah.
So very, very
and
interesting, really fascinating.
And in fact, there I would say that, in most cases, aggression is going to be driven by fear or anxiety. That's certainly... I can count on one hand the number of cases I've seen over the years. So, I've been doing this full time now for 7 years, right? And longer than that part time. The number of cases that I have seen where dogs are truly confident, aggressive dogs, I can literally count on one hand. And, in a couple of those cases, I have actually recommended euthanasia because there's just, there's very little that we can do when a dog has learnt that aggression, severe biting is a way to control their environment, and they're not an anxious dog. They're doing it to, keep people off their property or to keep people away from their things, right? The majority of the time, aggression is being driven by fear and anxiety. And so to turn around and say, oh, we should immediately sterilize or castrate your animal is probably the worst piece of advice we can give, unless the aggression is very clearly driven by the sex hormones. So if you have two male dogs in a home that are getting into each other, right, you want to possibly be castrating one of them. Or if you have a case where the dog is going off looking for a female on heat and constantly escaping and being hit by a car and things like that. Yes, absolutely in those cases. But I think in any other case, you want to first be getting to the bottom of why is this dog showing aggression?
So in your example of the two male dogs, if you had two males on the property and one is fighting with the other, which one do you castrate? The aggressor or the one being attacked?
That's probably something best left up to the behaviorist or veterinary behaviorist to decide, or the vet, because in those cases, you have to first figure out what is the trigger, right? So is it that they are fighting over something like resources, food, attention, toys, things like that? Because very often then, dogs that show resource guarding are generally anxious dogs. Right? I often say to people, confident dogs don't protect their stuff because they're like, it's fine. You can have my bone. I'll get it back later. right? It's the anxious dogs that are like, oh, if you take this toy, I'm never going to get it again, and then I will never have any more toys. That's their negative bias, sort of like, I must protect this thing at all costs, because if I lose it, I'm never going to have it again. If you come between me and mom now, like, mom is never going to cuddle me again, and she's my only source of emotional safety, right? So get away from here. So it's generally anxious dogs that are showing nasty resource guarding. I mean, within a multi-dog household, you will have dogs that be like, hey, piss off, get away from my stuff, and growl at each other. And that's normal. It's very normal for dogs to be like, this is mine, get away from it. And we shouldn't be necessarily expecting our dogs to live in complete peace. We don't want dogs bullying each other. But if your dogs every now and again are just having a little, growl, and the other dog goes, okay, sure, sorry, and walks off, there is nothing wrong with that situation.
They're communicating.
In that case, if you were to go and sterilize the dog who was the aggressor, you would probably be making the situation worse, because now you already have an anxious dog. Now you're taking away his testosterone, he's going to get even more anxious, right? Whereas if you have a situation where you're not necessarily reading it right, and the dogs are, low level, kind of like conflicty with each other all the time, and then, something happens and the one snaps at the other one. So that one starts it, but then the other dog freaks out and injures that one badly. The one that you need to sterilize in that case is the one that freaks out and injures the other one badly, right? Because that is the one that's showing the inappropriate aggression and possibly the being driven by testosterone too much at that point. So testosterone doesn't drive aggression. What testosterone does is it makes you lose your temper more quickly. Anybody who lives with somebody who has testosterone in their body knows this. It makes you lose your temper more quickly, and when you lose your temper, you lose it worse than if you don't have testosterone. So if you don't have testosterone, you can still get mad. It might take you a little bit longer, and you might not get as mad, but that's really the role that testosterone plays. So I think if you're going to be in that kind of situation, you really want to be looking at what is going on. When did this behavior start? How long has it been going on for? Because again, in that case, if the dogs have been having this kind of relationship for 2 years, you taking away testosterone is probably not going to do very much, because there's a huge learned component to that behavior, right? And then you really have to be addressing the root cause, but then also building a new relationship between them. We can't just, take away the one's testicles and think that everything's going to be hunky-dory after that.
No, definitely. So let's talk just general for the pet owners listening. What are some of the things that you generally notice owners are not aware of in terms of behaviors that might, just until you point it out, be contributing to these major events?
So what, in terms of like aggression? Body language, right? I think if the one piece of advice that I can give to people out there is go and learn how to speak dog, because it is so enlightening. It really is like learning another language. A whole new world just opens up to you, and you will be able to spend hours at the dog park watching the interactions between dogs. And just like any other language, the more you practice it, the better you become. So dogs communicate with each other and with us using body language, and that entails their eyes, their ears, their posture, their mouth, their tail. What is the tail doing? Where is it positioned? How is it moving? What is their general muscle tension like, right? So dogs that start to get worried, their muscles stiffen up. We go from that typical happy mouth open, panting, to a stiff closed mouth, a little bit of wrinkling around the lips. And you can see it once you know what to look for it. Your dog is like, and I appreciate that people can't necessarily see me at this point in time. So, your dog is standing there, open, lolling mouth, that typical like tongue hanging out the side, and they hear something or they see something, and immediately tongue back inside, mouth closed, while they kind of assess the situation. That is already your very first cue that you should be watching what's going on with your dog, right? Then something like posture. So dogs who are very confident tend to have their weight on their front legs, so their weight sort of more forward. The minute your dog is a little bit worried and fearful, they're going to start having their weight shifted a little bit more to the back. And interestingly enough, that's, one of the reasons why a lot of dogs don't necessarily like sort of the very muscular breeds, the pitties, the staffies, the bullies, because they already tend to be quite sort of heavily muscled and forward on their front legs, which just, makes them look like they're mad all the time. So then the other dog is like, whoa, you look like you're not so happy right now, so I better protect myself from you and be reactive towards you. And then the other dog is like, what? I didn't mean anything, right? Which is why socialization is so important. Your dog needs an opportunity to interact with a wide variety of dogs while they're growing up, to learn how other dogs communicate. That it doesn't always mean that a dog is looking for a fight when their tail is stuck up in the air and really stiff and their ears are forward and their mouth is closed. Maybe it means that they've spotted a rabbit in the field next door that they want to go and chase. And for your dog to go, oh, that's what that means. Just like as children grow up, they learn communication skills. Our dogs learn that as they grow up. So if pet parents can learn, and there are so many free resources available online. Some of my favorite, and I can give you the links if you want to include them with the show notes. So Lily Chin is amazing. She had all her posters originally with Boogie, the Boston Terrier, who was her Boston Terrier. She draws so beautifully and she captures so much of the nuance of that. And she's got this beautiful book called Doggy Language, a little illustrated book that really just talks about all those little things that we can look at. And then there is things like Dog Decoder, which is an app that you can get. There's a website called I Speak Dog. There's all Dr. Sophia Yin's work. So there really is so much free stuff out there. And I think just by learning how to speak dog and recognizing what your dog is saying is going to immediately make people more perceptive about what's going on. So something like ears forward, ears to the side. We talk about airplane ears, and then ears sort of like pulled back. And obviously, we're not looking at each body part in isolation. We've got to look at the complete picture in front of us. But just paying attention to that. And just like some people speak really fast, some people speak much more slowly. Dogs do the same thing, right? So you can have a dog who really sort of you think about those big Galumphy breeds, and like, what is over there, and they kind of turning their head. And by that stage, the Jack Russell is already there kind of investigating it, right? So I really want to encourage people to understand that their dogs have rich emotional lives and are speaking to them all the time. And we just need to learn how to recognize that, because it's going to enrich our lives with our dogs so much, even if your dog doesn't have a behavior problem.
Even from a connection perspective, I mean, it's so important to be able to, communicate back and meet their needs in some respects. Now, let's talk about that, because one of the things I find even as a pet owner is that often, historically, I'm getting better, but that I would reward the wrong behavior, or in anticipating, let's say I'm learning to speak dog and I'm like, hang on a minute, you do not look comfortable, that actually we can make the situation worse. So give us the advice in terms of, once you recognize that your dog is not comfortable with something, how to handle the situation without making it so much worse, and then or rewarding that behavior and having a situation that is going to get worse the next time.
So I think you can never really go wrong if you've got food, right? And people are often worried that by using food, you're going to reward a behavior that you don't want. But if the behavior stems from an aversive emotion or a negative emotion like fear or anxiety, you cannot reinforce those emotions. It is impossible. Right? Because by virtue of the fact that they are negative emotions, when we apply something positive that the dog likes, we get them out of that emotional state. So the typical example of your dog barking at the fence line. Now, dogs bark at the fence line for a variety of reasons. And I might be, saying some controversial things here, but I think we have normalized barking far too much. And we don't recognize that very often barking is a sign of distress. normal, happy, well-adjusted dogs don't actually bark that much, right? They might bark a bit when they get excited. You're about to go for a walk. They might bark to alert you to something. But I think dogs that bark excessively, and I recognize excessive is open to interpretation by whoever is the listener. But I think that, for instance, the dog who barks at every single person walking past their front garden, that is not a behaviorally normal dog, right? Because on the one hand, your dog is probably pretty stressed, right? I mean, imagine if you felt that every single day you had to run outside and go, don't come near my front door. Don't come near my front door, for every person that was walking past your road, right? They weren't intending to come to your front door, right? Maybe you could sit on the stoop, and if somebody came and rang your doorbell, you could be like, no, don't come in my garden. I'm not interested in what you're selling, right? But if you felt that every morning you had to run outside and shout at everybody walking past, I'm not interested in buying anything. Don't come to my house today, right? That would be a pretty stressful experience. So dogs who bark at everything that walks past their home are generally pretty reactive dogs. They're generally pretty stressed out and anxious. And what's happened over time is that they've learned that if I do that, the threat goes away. So they think that their barking has chased the person away. While in reality, if they had just sat on the veranda with you and watched the person go past, the person would have gone past anyway. So in that instance, if your dog is barking at the fence line and you walk up to them while they are barking and you say, here's a treat, and they stop their barking because, you can't really bark and eat at the same time, and they take the treat from you and they immediately go back to barking, and you say, here's another treat, and they take the treat from you and they immediately go back to barking, you are not actually reinforcing the barking at that point in time. What you are doing is starting to change the underlying emotion. And if your dog is not too far on the sort of behavioral problem spectrum, after 3 or 4 repetitions, they might actually keep their eyes on you to see if the next treat is going to be coming, or they might quickly give a bark and then look back at you, because they just have to check that the person is actually still moving on. And over time, we can start to change how your dog feels about people walking past the front yard, right? So people struggle in that moment to go, oh, but you're reinforcing the barking, but you're not. Because at that point in time, the barking is coming from a place of a bad feeling, right? So even if you were to stand at the front door and call like, Smokey, and your dog came running back to you and you gave them a treat, and then they turned around and they ran back to carry on barking at the person going past, and you called them again. When you call them and they come to you and you reward them, you are rewarding them for coming to you. And over time, that is a behavior that is going to increase, because that is the definition of reinforcement. Reinforcement causes a behavior to increase, creates the likelihood that a behavior will increase the next time. So by practicing that with your dog, and this, my dog used to do this when he was younger. He used to bark at the fence at the neighbors. And every time, just go to the back door, call him, shake the container, and he'd come running. Now, he does not, very soon after that, he stopped running off to the fence to bark, because every time we didn't go and shout at him, we didn't go and join in the barking by shouting at him, hey, go inside. And your dog's like, oh, great, you're here to help me. Quick, bark louder. This guy needs to move on quickly, right? So there are many things that, or should I say, there are very few things that food can't fix when it comes to changing our dog's behavior.
That's incredible, because I hear the same often, like, don't reward them, when they've gone outside the gate and then they're coming back, that recall, obviously you want to practice. You want to be able to reward them for coming back, so it's, or people who then reprimand them when they come back, so it's, it's incredible
so
some of the damage that we do.
Yeah. Why would your dog want to come back to you the next time? Because yes, I recognize you're angry and you're cross that you've been calling your dog for 5 minutes and they've only now decided to come back and listen to you. That is where we need to be adults. That is where we need to be big people and be like, Yay, thank you for listening to me and coming back. And next time you need to maybe work on not letting them run off so far, right? So that is why a lot of recall training we first proof the recall in a low distraction environment like your garden before we take it out into an environment where there are a lot of distractions. I always say to people, you cannot expect your dog to play, you wouldn't expect somebody to play Beethoven's Moonlight Sonata before they can even play Twinkle Twinkle on the piano. So why are you expecting your dog to do that? Because going out into a park with a dog who doesn't know recall and trying to teach them recall there is trying to teach somebody who's never played the piano how to play Beethoven's Moonlight Sonata. You have to first practice it at home. Then as we start to increase the difficulty, then we put our safety things in place, like a long line, so that if your dog runs off and you call them back and they spot a squirrel, you still have control. And they can't go racing off after the squirrel, because if they do go racing off after the squirrel, that's going to set your training back a whole bunch. And you're going to have to do a whole lot of work again to get back to that point, because chasing squirrels is highly reinforcing. Right? So when your dog does come back to you, even if they've taken a little bit of time, you have to be super happy about that. You have to give them all the best rewards so that next time when your dog hears you calling and they have something really interesting in front of them, like, a bit of duck poo that they're about to like roll in, and scent themselves with, you can call them and they go, "Oh, I don't know, the choice at this point in time, there's the duck poo, but I can also hear mom calling and I know that she's got a super nice piece of biltong for me," and they're going to come back to you instead.
So true. And I think, owners are often very motivated when they get a puppy, they join the puppy classes or puppy school. And then they think, okay, well, the work's done. I should now have an obedient dog. But, there seems to be, and I know I also totally understand as a pet owner, life gets in the way. We get very busy. You can only keep your motivation for reinforcing that kind of thing for so long. And then you want it to be done. But, from what you're saying is these things take time and there are steps and there's a process to actually having a well-adjusted dog longer term.
Absolutely. And I think thinking that you can go to puppy school and then your dog is going to be fine is thinking that you can send your child to grade 1 and then they can go and work as a IT technician. Right? So it just like, as I said earlier, your dog's brain is only physically mature by the time they're 3 years old. They go through all these different developmental stages in their first year, the socialization period, the juvenile period, sexual maturity, and then into social maturity. So their brains are busy changing. And just like you relayed with your teenage son, teenagerdom is something that is prevalent across the mammalian kingdom because it's how our brains develop. Right. So when mammals are born, their brains are pretty undeveloped, and then they go through a process of maturation. And part of that is myelination. So myelin is the substance around neurons that enable them to communicate more efficiently with each other. And myelination starts at the back of the brain with the sort of brainstem and the cerebellum, and then it gradually moves forward. And the emotional center of the brain, the limbic part of the brain, the amygdala and that hippocampus is all located sort of in the middle of the brain. And that is the part that's getting myelinated or has been myelinated as your offspring goes through teenagerdom, whether that is a dog or whether that is a human. So what we have during teenagerhood is that the individual has got an emotional center that is firing away at adult speed, but their prefrontal cortex, the part of their brain that is supposed to inhibit bad decisions, is supposed to alert them to risk and consequence of the things that they're doing. That part of the brain is not working as well just yet. So really it is biologically at that point in time, they are not mature adults and we cannot expect them to behave like that. Mood swings, impulsivity, risk taking, am I describing your teenage son or am I describing your teenage Labrador? Right? They're doing the same thing. And I think this is such an important thing for people to recognize, because I think it can be disheartening when you've done all the work of puppy school and maybe you've even gone on to the next lot of training classes, and then your dog develops cloth ears. Those ears just turn into these decorative appendages on the side of their head, and they're just not listening to you anymore. And I think the really interesting research, I think it came out a couple of years ago, showed that, we think, well, it's just kind of that it's just in humans that our teenagers actually then become defiant with their parents and don't want to listen to them. But there was a study that showed that even in dogs that happens. So they will listen to somebody else, but they won't listen to their primary attachment figure.
Wow, they tune out to them.
Yeah.
That's incredible. So many similarities, so much we can learn about parenting when you've got a dog. Love that.
Yeah, absolutely. Absolutely.
So before we lose the opportunity, some of the things that you advise owners should be doing potentially before they need a behavior consult. So some of the home remedies, can we talk pheromones? Can we talk about how the drugs, just briefly, that you use work when those things fail? Can you give some advice on sort of just general management and some take-home messages?
So I think the easiest thing that I recommend probably to 90% of my clients, and the 10% that I don't is because they're already doing it, and that the majority of behaviorists will recommend as well for dogs, and I'll get on to cats now, is feeding enrichment, right? Feeding enrichment is one of the easiest things that you can do, and it has a wealth of benefits. Right? It teaches your dog frustration tolerance. It keeps them busy. It builds confidence. It builds problem-solving skills, and it generates positive emotional states. So whether your dog is working through a puzzle, a commercial puzzle toy, or an egg box, whether they are playing with a food toy that you've stuffed, whether that's a stuffed Kong or a Westpaw Quizzle or a Roughwear Neutering, there are so many toys out there on the market that you can fill with food. And I refer a lot of people to a Facebook group called Canine Enrichment, which encompasses enrichment broadly, but focuses a lot on feeding enrichment, where people just share all the ideas that they're doing with their dogs. So, it's like the best parts of the internet is, like, for instance, the Canine Enrichment group on Facebook, which was started by Shay Kelly. And it's such a simple thing that you can do, and it can have such far-reaching benefits, because a lot of the time our dogs are bored. Right? We don't have enough time, or the walk that they're going on is just not enough. They were bred from working lines, and yes, maybe the breeder has now sort of started to incorporate a little bit more show line, or, are selecting for temperament traits that are more suitable as a family pet as opposed to a working dog. But, their genetic ancestry is still there, that they're working dogs and they don't have a job to do. So they invent jobs for themselves, right, to keep themselves busy. So feeding enrichment really has such a lot of benefit, and is something that people can so easily do. And I really feel can have such a huge benefit for dog welfare generally. I was in the Crazy Store the other day buying something, and I always look at what shops are selling in terms of pet supplies. And, they had this sort of like squeaky toys and that. And I was just thinking, if every single shop that sells a dog bowl stopped selling that dog bowl, or just sold it for water, and instead started selling like a food toy that somebody could put their dog's meal into and give it to them, we would immediately increase the happiness of dogs across the country, because there have been studies that show that dogs actually prefer to work for their food. Right. So studies where they've given dogs the choice of eating out of a bowl or eating out of a food toy, and the dog has chosen to eat out of the food toy. Why? There's free food right there. Because, why do you sit down and do the crossword puzzle? Right? Why do you play a game on your phone? Because it's stimulating for your brain, and our brains require that kind of like engagement. If your dog was living as a wild, free roaming dog on the street, they would be spending a significant portion of their time budget on a daily basis acquiring food, whether that was hunting, scavenging, sniffing, digging, tearing black bags apart, going after a mouse, trying to catch a bird, eating scraps. They would be spending a lot of their time. But now we bring them into our homes. We put 95% of the calories that they require into a beautiful silver dish, and we place it in front of them, and they scarf it up in 5 minutes if they're a normal dog, 5 seconds if they're a Labrador. And then what have they got to do for the rest of the day? So that is my first piece of advice, feeding enrichment. Then I think there are many calming supplements and anti-anxiety remedies and that are available, and that's great. And those things should absolutely be used preventatively, right? When you first start to see something that's not 100% right. I don't think you should be turning to those things when your dog has already bitten somebody, when your dog has already injured itself trying to escape the garden during a thunderstorm, when your cat is already sort of peed all over your curtains, right? Those things are great to use if you're moving house, if you're doing renovations, if you're going on holiday, whether you're taking your dog with you or leaving them with a pet sitter. When you are sending your animal to the grooming parlor for the first time, if you're getting the groomers to come to your home, anything that's likely to create stress, that is when those products are brilliant. And I think we should be selling a lot more of them, but we're selling them for the wrong reasons, right? When dogs have already shown behavioral problems that are extreme enough that they are causing stress for the family, stress for the dog itself or the cat, then we need to be turning to the harder stuff. And that is where medication plays a role. Because yes, there are animals who are genetically anxious, right? They have been born with an anxious temperament. And while we can probably get past a lot of that anxiety with an excellent diet, enough exercise, feeding enrichment, appropriate socialization, sometimes those things are not enough. And then we need medication. And I have just seen over the years the difference that medication can make to a dog's life and how it can improve their welfare. And so, yes, there are absolutely people who use medication in the incorrect way or for the incorrect reason, or you just use the incorrect medication. And what we need to know is that medication should never be used to suppress a dog's personality, to sedate them, or to turn them into a zombie. Those are never, ever the reasons that we should be using medication. Medication is there to help have an impact on neurotransmitter levels in the brain so that your dog's brain can work the way that it is supposed to and so that they can learn, because anxiety impedes learning. Right? And when your dog is anxious, you can be spending thousands of rands on individual sessions with a trainer or behaviorist trying to teach your dog a new behavior. But if they are too anxious, you are wasting your money because they are not going to be learning. And my best example of this is I have a fantastic client. And if she's listening to this, she knows exactly who it is. And she has done such a lot of work with her dog. Her dog was a rescue dog, and they did such a lot of work with her. After they got her, I think they got her when she was about a year old. So already a lot of stuff that she had gone through. And they did so much training, all positive reinforcement. She was such an advocate for her dog, really looking out. And they just weren't progressing beyond a particular point. And then they came to see me, and I put her dog on medication. And the updates that she sends me now are the best part of my day, because whenever she sends me something, it is just to show how well her dog is doing. And she's still doing all that hard work, but now she's getting the satisfaction of seeing her dog making progress, and her dog is getting the benefit of making progress. And it is cases like that why I do what I do, because it just brings me such joy to see them thrive in their partnership and to see the joy that they get from each other because I was able to prescribe medication for her dog.
This has been so inspiring in terms of this, and I'm so grateful for all the information you shared. And I know that a lot of my listeners are going to want to know whether they can contact you, whether you do online or whether you only do in person. So tell us a bit more. So if people want to contact you with a question, or if they want to come and see you, how they can get hold of you.
So the best thing is to go to our website. I have a booking questionnaire that people have to fill in before they come and see me. And it takes about an hour to complete. And it is one of the ways that I really get people who are very dedicated, because if somebody is not prepared to fill in a questionnaire that takes an hour, they are not going to be able to do the work that they have to do at the end of the day. So I mean, it's great for my job satisfaction because I get such dedicated clients that come and see me, who are committed to the process. And I do feel for my colleagues in private practice where, they are maybe just getting bombarded with people asking about fixing behavior and who just want quick fixes, right? So people can go to the website. I do online consultations with a couple of caveats. So they must have a veterinarian that sees the dog on a regular basis, and that dog must have gone to the veterinarian within a recent enough amount of time before I'm allowed to prescribe for that dog. So I prefer to work with the veterinarian and give my recommendations and allow them to dispense the drugs. But if they're not comfortable with doing that, I am able to write scripts for people, but the veterinarian must always be involved. And then I do offer a service where I just do a medication assessment. So where a client is already working with a behaviorist, a qualified behaviorist, then I offer a cheaper service where I'm just kind of looking at what meds can we use, where to really just amplify their process and help them to make the progress that they want to be making at that point in time. So that is something that I would prefer to do with clients who can't bring their dogs to see me, because it is, as you know, so valuable to just have eyes on that dog and to be able to see them.
Very much so. And I mean, I know we haven't, and I do hope that you will be a returning guest, because there is so much that we haven't unpacked and discussed, including hopefully in a future episode, we can discuss the impact of pain on behavior, because, we haven't even touched the surface of some of the things that I know veterinarians dealing with behavior consults, but also owners are dealing with. So I hope that you will take up my offer of returning to unpack some more and possibly discuss the cats.
I was going to say, it's and definitely for the cat owners, I feel very bad for the cat guardians out there, because I haven't touched on cats a lot, and cats are not just small dogs. I have a lot of things to say about cats as well. So maybe we can say, yes, in a future episode, we will get into the nitty-gritty of cats.
Definitely. And I'm super cat obsessed. And I also totally understand, especially with multi-cat households, how commonly you do have those kind of behavioral issues. And there are simple modifications that we can be putting into place. So definitely want to talk about those with you in a future episode. But I'm so grateful for your time and expertise. There's been stuff that you've said today that I just was totally unaware of. So it's been really informative for me. So I hope my listeners have found the same. And we will obviously provide all your contact details at the bottom of the notes, so people can contact you and all the links that they can find you. So thank you so much.
Thanks very much. I really enjoyed it. Thank you.
It's been super interesting. Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Justin the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hypo what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.